Our skin constantly fights gravity, but aging takes away the quality of its youth, thus causing our skin to loosen over time. Up until now, plastic surgery was the only option for lifting. But technology has provided us with a new, non-surgical solution, HDPDO. Each face has a unique geometry. HDPDO technique is designed to provide individual patterns to best suit you. HDPDO uses FDA-cleared threads made in Italy. Visit hdpdo.com to get your certification in soft surgery and enter the new era of aesthetics.
All right. I think we'll wait like maybe 2 more minutes, but meanwhile, I'm just going to say I'm here today with Dr. Arash, and we're going to do the webinar together, so be able to cover as many questions as you guys have and any specific techniques. And if you're already using our threads, we'll be happy to answer all your questions. And also, this question is going to be good for anyone else who will be joining us in the future. So we'll be sharing and answering all your questions at the end of the webinar. And because most of the time we answer all your questions while we're doing the webinar, and you'll get your, you'll see them that we're going to cover everything. But in case we're missing anything, just wait till the end of the webinar, and we'll go over it together so everyone else could use it too. And make sure that you have your computer on mute, and we're ready to start. Dr. Arash, when you're ready.
Okay. So, hello and happy Saturday, right?
Saturday, yes.
Okay. So we're gonna start with thread resurfacing, which is our first subject, and then so the before I start, I want to as a co-host.
Sure.
So the HDPDO is composed of completely absorbable thread, as you guys know. It's made by PDO, and we made it in a high density way, under high temperature and high pressure. All the story about the HDPDO you guys know. So today I'm going to focus more on the techniques and basically different indication. The mechanism of action of PDO thread is repositioning the targeted tissue through barb. You pull the tissue through the barbs, and you can reposition, lift the tissue. You can hold and stabilize the loose or saggy skin because of the tensile strength, and also the presence of the PDO thread will basically hydrate the tissue because it absorbs the water. It biostimulates the tissue, and also it activates the fibroblasts because of the mechanism stimulation. So you will have regenerated collagen, and also after like 2-3 months, which the process is almost complete, you will see microfibrosis around the thread, which will be like the natural thread made by your own body, and that will last for a year or year and a half. This is briefly about the mechanism. So we have 4 types of indication for threading. Number 1, and the most famous one, is lifting. Then we have the reshaping indications, and then thread resurfacing, and deep revitalization. These 4. So we're gonna try to cover as much as we can. Wrinkles, we can divide wrinkles to 2 types: fine lines and also deeper furrows. And we treat them in a different way. The cause of aging, smoking, skin type, heredity, sun exposure, chemicals, and all those different basically reasons that we all know. But how to treat wrinkle? Right now we have I mean, if I want to start from the beginning, it was like chemical peels and all the different kind of peeling, dermabrasion, microdermabrasion, laser resurfacing, fractional laser rejuvenation, plasma-based device like flexor, injectables and fillers, high intensity focused ultrasound, plastic surgery, endolift, thread lift, all those different varieties. Which one basically is the best? So for the resurfacing stick of the skin, basically the most successful one right now is laser resurfacing, and it burns the skin from epidermis. And it is kind of successful. The limitation is you cannot use it for darker skin. You cannot use it for during like summer or sunny areas. Like here in California, I think the best time to do laser resurfacing is just like 3 or 4 months, which is kind of winter here, winter and fall. So, and you have to repeat that several times. The result lasts for less than a year. And this is actually the best we can get for laser resurfacing. But regarding thread resurfacing is basically not just epidermis. We go to do the dermal reconstruction and also subdermal reconstruction. So the resurfacing that happens with thread resurfacing is basically very deep, and it covers all the layers of the skin. So as you see, these slides show you the process of aging, and the aging change during the change in basically dermis during the aging. And as you see here, you will have less fibers and less collagen and less basically elastin. So in general, this is like the young skin, and by aging, you basically lose a lot and you gain a lot. What you lose is your collagen. What you gain is excess skin. You will have more skin than your surface. So that's why the skin gets like wrinkles. As you see here, the surface of the skin is more than a young skin. So to treat this skin, we need to basically treat all the problems at once. So as you see, we have more epidermis, so we have to reduce the epidermis. We have the dermis, which is destroyed and has no collagen structure. And then in subdermis, we lost the mass, we lost the fat because of fat atrophy. And in the muscle, we have loose muscle, we have less muscle, and we have basically sagging. So epidermal atrophy, dermal atrophy, subdermal atrophy, and muscle atrophy. These are the 4 different reasons for aging. So to handle the epidermal atrophy, we need to remove the excess skin, as we said. For the dermal atrophy, we need to restructure the dermis. We have to activate the angiogenesis. For subdermal atrophy, we need to restructure subdermis. We can do the fat rejuvenation, which is a new technique, and we can talk about that in another webinar. And then for the muscle atrophy, we have muscle lift and reinforcement technology, which is also a topic of another webinar. And if we do it all, then we can have a younger and a smoother skin, but the real one. So for the epidermis and subdermis, these are the subjects of thread resurfacing. And we use different kind of thread for each part of that. So to do that, we have 2 techniques. One is intradermal, a smooth HDPDO threading, and the second one is subdermal, barbed HDPDO threading. So we divide them by basically different categories and style. The first one, if you have just one fine line, for example, somebody who is at the age of 40, she got a Botox injection, and after Botox injection, still they have, you see some few fine lines here and here. So for them, you just need to insert intradermal, a smooth thread, right underneath the wrinkle, as you see here. So this is epidermis, this is the dermis, and you put your thread, you implant your thread right underneath the wrinkle. If the wrinkle, if you have like multi-lines, multi-fine lines, that usually happens in the cheek area, you try to basically crisscross your threads to the wrinkle, as you see in this picture. In case of droopy creases, like around the eye, you need to create a mesh because you need more structure. And this structure, again, is in subdermis. So this kind of basically fine lines needs dermal reconstruction more than anything else. You don't need to use barb thread, and you don't need to go in subdermal in these cases. If you have deeper skin line, for example, same example of the last one, but here somebody is 60 years old, and after injection of Botox, still they have lines, but this time the lines are deeper. So to handle this deeper line, which is now aesthetic line, it is fixed because it's not related to muscle anymore. So you need to place your barb thread right in the subdermis, right under the line and wrinkle, and that will handle it. That will basically resurface it. And if you have multi-dip lines, then you do this in subdermis, crisscross to the line. And if the crease is super deep and like it has also some kind of like hole shape form, then you need to have more structure. And in this case, you basically use a mesh, and you create a mesh underneath in the subdermis. Sometimes you have to use the combination. When you see that you have fine lines and you have also deep lines at the same time. If you look at the first picture here for the smoker line, as you see, this lady has aesthetic lines and wrinkles. So she's not smiling. She didn't show us like a kissing maneuver, but still you see those fine lines. This basically shows the lack of collagen and aging in the dermis. So it means that you need to insert intradermal thread. And also you see that when this, you can see that when this lady will talk, you can see deeper line, which I can show you here, like the places that might happen, or here or here. So in this case, you also need deep reconstruction. So you need to put your smooth thread in the dermal layer, and also at the same time your barb thread in subdermal layer. And if there is more lines and wrinkles, then you have to do more and crisscross to the line like this one. And in case of very severe, basically wrinkles like this one in the marionette area, then you need to basically mesh, one in the dermis, one in the subdermis, to hold it still and hold it up. And this will give you like the maximum result, which lasts at least for 2-3 years. So here, just to show it more in detail, we have the mesh in the dermis, and also we have the mesh in subdermis. The type of thread we use, it depends, like the length of the thread, it depends on the area. Usually we can use 3 cm, we can use 5 cm, we can use 7 cm, but most of the time we use 5 and 7 cm. For the subdermis, it depends on to the area. For example, if we are treating like the underarm, we might use 15 centimeters. If we are treating like the abdomen, we might use 15 or 9 centimeters. But if you are treating like the cheek, it could be 5 or 9. Here are examples on how we use this technique for resurfacing. Please note that this technique has zero limitations. So you can apply this technique for darker skin type or lighter skin type. You can apply this in the summer or winter. You can apply it in, I don't know, in Florida or California or New York, anywhere in which any kind of condition. So there is no limit in terms of that. And also it's easy to repeat, like after a year or two, if somebody wants to repeat, you can repeat that. And unlike laser resurfacing, you know, after laser resurfacing, when you expose to the sun, even 6 months after or a year after, you get red skin. But here it has no like adverse or side effect like that. So in this picture, as you see, we placed the mesh in the marionette line and also for the nasolabial line. And also this is the smooth mesh, which is in the dermis. Usually what you do, you place the subdermis threads first, and then you go superficial and you insert your superficial intradermal threads. This is more clear to see and understand. Here again, there is another pattern because this part of the face you have most problem. So step by step, this is the sign of entry point, and entry point is the point that you enter your insert your needle into the skin. The entry point, as you know, should be 2 centimeters apart of the proximal tail of the thread. As you see in this picture, for the the buccal line, it's very difficult to treat, and except flexor, which is a new technology, there is no other basically technique rather than thread resurfacing. So in thread resurfacing, when you want to treat this, you enter from here. So first we inject our 5 or 9 centimeters bark thread in the subdermis, and then after that we implant our smooth thread. And in this case, as you see, we have a mesh, but this mesh is kind of the combination of a smooth and barb. So if the wrinkle is not too much, then we can have this kind of pattern. The other one for the cheek area, which usually it's very common, especially in white skin color, you see this kind of wrinkles in the cheek area. So you enter from here, and to have the line, you can basically kind of create a line from here to the angle of the mandible, and then this will be your entry line. And from here you start. And then after that, you start with your 7 centimeters smooth thread. You enter, and this will be the end pattern. For the nasolabial line, what we do basically, we place 1 or 2 5 centimeters barb thread, and then 3 centimeters smooth thread. So this basically is the best way you can treat a nasolabial line, because it lasts over 2 years, and also it creates a very natural way of rejuvenation. If your patient insists, then you can inject also a little bit of filler here. That can help. And in this area of the face, you need to be very careful about injecting filler, because usually you don't want to have more volume and more basically tissue in this part, because aging gives us enough. So if we inject filler for the nasolabial line, and then for the marionette line, and then for the chin, and then for the lips, and then we inject too much, you see after a few years something happens that we call it monkey face. this area of the face will be like a monkey, very basically full and very big. So to prevent that monkey face, using thread and combining that with filler gives you a very natural, organic look.
Maybe, Dr. Arash, I could add something really quick. I mean,
Sure.
we're going over all the slides, but there's one thing always about, and people always ask me to, combining the filler and threads.
Yeah.
If you want to explain, I always explain to them that you could always combine them. Technically, you'll see that with threads, we could combine everything, but again, you have to do it in the right order. We always prefer to do threads first and place the threads where we want. And then after that, we'd add the filler. But we never start with the filler and then we start inserting the threads to go inside the filler because, again, for many reasons. Once, we don't want to get into the gel of the filler because we need to stimulate the tissues under the skin. And second, if we need to like grasp on something, especially if we're using a barbed threads, we need to have the tissue to be attached to the barbs in order to do the liftings that we want. So yes, you could combine them with filler, and sometimes it's very good because the filler buys you the time that we need to build up the collagens, the look wise. And sometimes you get the beautiful results from the beginning, but make sure to do it in order. First threads, and then we do the filler.
Yeah, that's right. Thank you.
Thank you.
So, and then this is also another pattern of using 3 centimeters, a smooth thread for nasolabial line. This is when you have like a young person, so you don't need to use your barb thread. And if you want to also work more and give more tissue regeneration and you have deeper nasolabial line, then you add 1 or 2 barb. For around the eye and preorbital lines and wrinkles, basically this is one of the most difficult wrinkles to treat, and also it's very delicate because it's close to the eye. And right now, basically the problem is when we learn a technique, then we want to use it for everything, and that is the source of the problem. So injecting filler under the eye, it's not a good indication, and also it is very dangerous, and it gives a very unnatural and unorganic basically form when you inject filler here. So to avoid that, we developed a technique for preorbital lines and wrinkles, which works well, and also it looks very natural and very effective. So first, you place your smooth thread, and you can use 3 centimeters. Then you use 5 centimeters smooth thread, and then we'll see this pattern. This will hold the whole area, eliminate the wrinkles, and also stimulate the collagen. And it keeps your under the eye and around the eye clean, rejuvenated, and healthy. And also it helps on dark circle around the eye.
I just want to add something to this because this structure is actually really good, especially for resurfacing. But there is one thing that we need to be always worried about, and that's the danger zones. So on the with the orbits around the eyes, this is a place that we don't want to insert anything like fillers, Botox, anything. Like, I mean, this is very dangerous. But you have to make sure that the border and where your ending of the thread will be, it will be right above right at the line of the orbit, basically around the eyes. Yes. So we don't want to enter the empty area basically because it's very dangerous. That's all to add.
Yeah, and also you never enter your needle like this. As you see here, the needle is slided, so the risk of causing any damage to the eyeball will be minimized in this way.
I'm sorry, I'm just going to say, by the way, you guys could, Dr. Carlos wrote me a question, which is good. I'm going to share it with you guys while we're doing the webinar. Is asking, is the barbed 4O. 7 centimeter is too long for the face. First of all, the 4O threads, those are barbs, and then and we don't have 7 centimeter. We're not using 7 centimeter. And the 7 centimeters are smooth ones, which is 6O, and is a thinner one. Based on the size you're using, so you could explain this one too.
Yeah, one more thing about that is when we say 7 centimeters, we are talking about the whole the total length of the thread. And as you know, our threads are folded, so it means that if from here to here is the whole length of the thread, when you fold this, then it will be half. So if we have the 7 centimeters thread, it means that the folded length of the thread is 3.5, and if there is 5 centimeters thread, then the folded length is basically 2.5. So another indication as a resurfacing is for the yellow, and it works very well, especially for people who had several holes and here. And then the other one is for décolleté. Décolleté and chest area is contraindication for laser because there is a high risk of keloid. So, and also the aging happens here from early age, from 35, 40, you have lines and wrinkles. You see the line and wrinkles here. To prevent it and also to treat it, you can use this thread resurfacing technique. It works very well here, and again you combine the barb and smooth thread. So here you see another example of combining all these techniques in one piece. So to answer the previous question about different sizes, in our brand, it's very simple. We have smooth, we have barb. And then the smooth has 3 sizes, the barb has 3 sizes. For a smooth, we have 3 centimeters, 5 centimeters, and 7 centimeters. This is the total length of the thread. And as you see in this picture, it is folded. So the folded length of 7 centimeters is 3.5, 5 centimeters is 2.5, and 3 centimeters is 1.5, which 3 is basically designed for around the eye, for the bunny lines, for a smoker line. 5 centimeters is designed for the brow shaping, for face, neck, and 7 centimeters is designed for cheek, for underarm, for the chin, and so on. For the barb thread, we have double-sided barb thread, and in this basically category, we have also 3 different sizes. 15 centimeters is something that we use it for butt lift, we use it for pubic lift, we use it for underarm, we use it for breast lift, and it works perfect. Basically, this is like one of our signature threads, and it needs some advanced training, but the result and outcomes out of 15 centimeters thread is just phenomenal. And then 9 centimeters thread is like what we designed for the J-lift technique, and which is our most selling technique. This will give you kind of like an oval shape, like Nefertiti shape of the face, and it also attach the face. It basically kind of lift the cheeks too, and define the mandible line. 5 centimeters thread is designed for preorbital area, for the marionettes, and also for the chick. So here is the result out of the thread resurfacing. She is 73 years old, and she got thread resurfacing in the buccal area, as you see. So look at the skin texture here and then compare it with this. You see the difference, and here is more obvious. So the other examples for thread resurfacing is for the chest and these techniques. This is for the neck. The distribution range between threads during the thread resurfacing is about 1 cm. So if you place one thread here, then the other one should be 1 cm far from this. So this is one of the good results coming out of thread resurfacing. This is right after the procedure. If you guys are using our threads and you want to share any of your results, just text us and we'll unmute.
I just want to add something to that picture, Doctor. The previous picture. This is very interesting case, and always use it because this was during a training of one of our doctors that we're working with, and this lady, she actually was allergic to lidocaine. And that's why I always try to mention this and bring it up. So we kind of did like a full face for her, and she was allergic to lidocaine, so we didn't even use a topical numbing. And I know one of the things that we do is instead of anesthetics injection, we use topical. But in this case, we don't even use that, and we did the full face. I think it took us about 20 minutes, 25 minutes, and she didn't feel pain at all. And then this is the immediate results, as you see on the pictures. You could even see still the insertion points that is still showing. And we took a picture right away to compare them. And as you know how the thread works in general, it's a progressively improvement. So as the collagen start building up. So this is the immediate results, but imagine in a month and a half when we're checking there, what the results we're expecting. And then it was getting better as the time was passing by. So in 4 months, in 6 months, in 8 months, it's just getting better and better. But I always want to say, like, if you do the technique right, and you follow the right mappings and you place your threads in the right plane, as the doctor was explaining about the intradermally and subdermally, then it shouldn't be really that painful, And I have a lot of cases doing without using any numbing cream.
Yeah, that's right. So stretch mark is another problem which there is no perfect solution for that. Thread resurfacing works well, especially for kind of stretch marks which is droopy. And as you see here, you use 5 or 7 centimeters and you make a mesh. Inside of the stretch mark, you can also place barb 5 centimeters. And if you guys, because many of you guys, you have also our plexer plasma device, then you can also add plexer to this technique and get the better result too. So this picture is has a story which you guys might know. We treated the left side of the, this side of the face during the training in Houston, and then the doctor said, I'm going to treat the other side of the face tomorrow. So I had to fly back to LA. And then the tomorrow took about 5 months. 5 months after, I was again in Houston and I met this lady. So still this part of the face was not treated and this was treated. So you can see the actual before and after in one person, 5 months after threading. So the nasolabial line and the marionette line, this mandible line and the sagging, which you have sagging here, you don't have it here. Look at the cheek area, cheekbone, and compare it to this, and also the lines and wrinkles around the eye here, and compare it to this. So this is, to me, it's a very valuable picture as it shows the real before and after. Here, there is another picture. Again, this is treated, this is not treated. This is about face reshaping and resurfacing around the basically commissure. You see this line and also this droopy, and here is fixed. You can also use thread for hair growth, which basically works well. And then we have a video from this doctor, Dr. Larry, who does this procedure, and he's happy about the result. Okay, let's watch this video very quick, and then we get back to our slides. as you see here, we use 5 centimeters of smooth thread, and then we go basically subdermal, not intradermal, because there is no way you can go intradermal in a scalp area. It's super thick. The mechanism of action in this case is different. Here we try to, for the hair loss, we try to activate the follicle. And most of the medication works for that are basically trying to activate the circulation. And in this case, by implanting a thread, the whole circulation will be activated for the next 6 months continuously, because what happens is when you inject some like foreign body inside the area, then your body react, and the reaction of the body will be combined with angiogenesis and also increased blood circulation and vasodilation. All those 3 items makes more, basically bring more nutrition for the hair follicle, and the result is really outstanding.
I just wanted to add, I had a couple of cases myself that we did the treatment. I just put the picture on, but we did the treatment, and after 3 or 4 months, we saw amazing results, which I'll be happy to share it individually with the picture. But we couldn't put it at the webinar.
Yeah. So now we go to another slide, another subject. So facelift is the main indication for threading. And we have a very specific, basically, technique to do that. So the old school technique was they were trying to inject a thread which was permanent and then stitch it to temporal muscles. And they had hook and they had barbs. The problem with the technique was the thread after 5 or 10 years, because still you could see it. And especially after like fat atrophy, then you could see the thread. So, but the lifting was okay. The result was good. So using another polymer, which is PDO, was a good solution for that. But then when we started, when people started to use PDO thread, they forgot that the original technique is stitching the thread to the temporal muscles. So to make it easy, there are lots of thread out there which you implant the thread, but thread is floating in the skin. So for the last 10 years, this technique, which I call it floating, old school technique, was out there and it still is out there. So the thread is like one suture of thread. You place it here, and usually you use cannula, and it is very long. And the thread works there, and what it does, it can also keep your skin a little bit fixed, and is not able to actually lift the skin. So to handle this problem, we developed a new technique, which is double-sided folded and salmon ladder technique. In this technique, the thread, instead of stitching the thread to the temporal muscle, we designed a double-sided thread, which one side of the thread will lift the tissue, and the other side of the thread will actually attach the thread to the tissue, like a deeper layer of the tissue. So if you see here, this guy is trying to pull him up, and he's trying to put the rod in the higher, basically barbs. So if the salmon ladder itself was not fixed to the wall and it was floating in the air, he couldn't get himself any higher or lifted. So if you note to these screws which are binding the salmon ladder to the wall, we basically have the same technique in our thread. These barbs inside the needle, they are fixing barbs. They are like the screws, and their job is to fix the thread, to attach the thread to the skin. From the other side, from the other hand, we have the exterior barbs. These exterior barbs are lifting barbs, and what they do is basically they are trying to lift the tissue up. So like it looks like that our thread has two hands. In one hand, he's trying to hold himself, and by using the other hand, he's trying to hold the tissue up. And that's why we have double lifting action. We have internal and we have external barb, fixing barb, and lifting barb. So the thread itself is fixed in the tissue.
Actually, Dr. Arash, this is the reason a lot of people ask me, how come, like, there's the other threads that they use, we don't have any limitations of the directions that we're using our threads to give lift. I mean, they'll be surprised that we tell them, like, however, it's more comfortable for you. As long as you know the vectors, you could go from the insertions from any directions and you still get the lift that you want. And it's only due to this technology and this model. This is a way that you could enter from, if you go from, upside down, or if you go from upward down, then you still get the same lift, the same vectors that you want, because one of them will do the, ideal lifting that we want, and the other one is going to do the fixing, as Dr. Ash explained.
Yeah. So,
I'm sorry.
No.
I think Carlos is asking if we could explain the salmon techniques. I'm just going to kind of reword what Dr. Arash was explaining, just in a different way. Maybe this one makes a little bit more sense. It's, as you mentioned too in your questions, some of the threads, as you saw, part of the thread is inside inside the needle. The other part is outside, right? So when we're applying and do the insertions under the skin, the part that is outside, that's the part that is going to get engaged, and then it's going to do the lifting, right? But now, let's say we have one direction going up and lifting up, and then now it's connected and we've done the lifting, and now we want to remove and release the other side, which is already inside the thread. If we didn't have the other side with the opposite directions of a barb, then we wouldn't create that fixing, because it would come back down, and it would the thread is going to come back. Actually, the body is not going to be holded and lifted up. So when we place the needle in there with the thread that is out, the barb is going to lift. When we remove the other side, since the barbs are opposite directions, they're going to exactly keep them at the positions that we gave the initial lifting. Okay, so we need one to do lifting, one side, which is out. And then when the other side comes, it's the opposite direction, and it's going to create the lifting for us, and it fixes in that positions that we did lifting. We explained. Hopefully, if there's more questions, just keep asking me, and I'll try to write it to you.
And also, you're more than welcome to set up like a demo. During the demo, you will see for yourself how it works. So one of the other techniques that we have is basically the lifting technique, is 7-step lifting technique. So the 7-step lifting technique is basically to design personalized patterns, because the problem with most of the other techniques is that you have fixed technique for everybody. For example, you enter from here, you go here, 1, 2, 3, and that's all for all the basically other people. But here, what we have, we believe that each face is unique, and we need to basically design a unique technique for each person. So we try to we try to design a pattern based on the anatomical structure of the face. To do that, what we do, we mark the sagging, then based on that, we design the pattern, which is the subject of our basically practical training, and you can register for that. So here is some examples. Here is one of the results coming out of this technique. And this is like 2 months after the procedure. It's like a full face. This is the result out of the J lift technique, which minimize and lift the skin. So here is another one. You see the lifted cheek compared to that part, and also the elevated mandible line.
I mean, what is very interesting. I want you guys to see, because I experienced this a lot, especially with the threads, is when you go back with the reactions of the patients right after. I always like that picture, because you see the ladies looking at herself in the mirror. This one is always my favorite, because this is the reaction I'll see a lot of time. And believe it or not, I have a lot of people hugging me after for being so excited about the results. But what I want to explain to them, and I always explain to these people too, even though they're happy and they see the results, you get some a bit of an instant results. But as we know how the thread works, it's something that we need to add more collagens under the skin. So I always tell them, whatever results you get, probably like a month and a half, that's when the actual result starts. So the collagens build up around month and a half to 2 months, and then progressively it gets better and better. So if they don't see immediate, very extreme ones, then but they're going to be happy like this. They see some results, but eventually tell them that they need to expect more, because eventually it's going to get better and better. With our threads, it's going to last almost for 2 years for them of improvements. But yeah, I always love these pictures and things that I see after in the patients.
Perfect. This is the picture. This is the real J lift, and this is like the complete J lift. For the breast lift, you can again use your barb thread and combination of barb and smooth, and also you can add the longer thread size too. For the butt lift, which we can name it Colombian butt lift for Dr. Carlos. This is the combination of 9 centimeters and 15 centimeters, and also this gonna go crisscross here to create like a fold and definition for the butt to the thigh. And also this is another technique for the butt lift. These techniques are really good. They work well, and they also handle some of the like a droopy cellulite effect in that area. Okay, for the side effects, let me show you another video first, then we go to the side effect. Okay, go ahead.
So I'm just going to explain what's happening. If you guys don't have a volume of this, this is the case that we did the lower face on the jawline, and we were trying to do on the border lines. I think that one of the lines, one of the pictures that we showed you, and this is a case that we're going to lift the face up, the jawline up, and also pull it back. And all I'm showing over here is like how we're mapping it and how we're showing the vectors and then the directions and the number of the threads that we'll be using going up and going back, which during the private training, we always go through the details and I tell you exactly what sizes to use, how do the distributions and the sizes you need to use and what candidates, who's the best candidate for this. And also we teach you exactly to do the drawing and mapping before inserting. This is just an example, and you could see how comfortable the patient is. And we're placing our barb threads right now to do the lifting. And as you see, like we're placing it on the subdermal. And we as we talked about earlier too, you have the options of either going from down to upward, or go opposite directions. It doesn't matter. You still could get the lift, the same vector, and that's the beauty of the sound effect. And forward a little bit to see. Again, during the private training, I explain every little mapping. We go through all the sizes, distributions, and the techniques that you should use, and things you need to be consent. So this procedure could be done in like about 10 minutes. And as you see, the patient is a very comfortable situations, no pain. We only use the topical numbing cream, mostly for the insertions, and that's it. So we did the lifting up, and then we start pulling back. Again, you have the options of going both directions if you want, as long as you know the vectors and you mark it right. This is going to give a great basically structure of a mandible, because we're kind of lifting it in two different directions. And it's a very common and very popular indications too. I think everyone's asking for this. You notice when you're in the right plane, it goes very smooth too. You don't have much of resistance. And the last one I did, it was right at the mandible, because you could easily control where you're going, where the needle is, where the tip of the needle is. We removed it easily with no paint, and we're done with this. You could see, I mean, it's not showing perfectly, but we got already instant results on the jawline.
Yeah, I can see it.
Yeah, I could see the difference. And he was very happy with this. Even on the chin line, you would see there's drupal on the chin, and then on the other side. And sometimes this kind of helps with the commissures too, the corner of the lips, and also the cheek. It does. So again, we'll tell you, like, if you have to do multi indications, which one you should start first, because then you might not need to use as many threads as you would do individually, and it could help each other out too with indications.
So we get back to our slides here. Let's go to the side effects. So basically for the side effect, we don't have that much side effect about our HDPDO threads and techniques. One of the rare side effect is basically superficial thread implant. It happens when you go too superficial. The best way to basically handle this is when you are inside and you see that you are superficial, you just push your needle up, and then you have your needle out of the skin, you remove the thread from this side, and then you remove the needle from the other side. So you lose one piece of thread, but you handle the problem before it happens. If it happens after you basically remove the needle, then and you want to take it out, we recommend to wait for 2 weeks first. After 2 weeks, you can use like a hook-shaped needle to go right underneath and then take it out. Bruising is rare, like this one, but it is possible. This case is rare because she used some anticoagulants, so she had bad bruise. But vitamin C, healing ingredients, IPL, radiofrequency, you can use all of those. The thing is, in HDPDO, you are allowed to use radiofrequency or IPL. It doesn't destroy the thread because it is thermal resistance.
I just want to add something as a question just been by Cynthia. That's true, and that's why the doctor said that we should leave the threads for 2 weeks sometimes, because, I mean, yes, the thread is going to be dissolved eventually, but the good thing about these threads is like it takes long to dissolve, and that's what we want. We want it to stay as long as it can, so it will be effective and stimulate the threads. But what it will helps to come down for the waiting that it says over 2 weeks or even more longer sometimes is because when the collagen start building up, it's going to start forming around the thread, and it's going to kind of pull it down. And then when it's full with the collagens, then the superficial thing is not going to be effective. It's not going to show itself much. And I'm going to add one more thing to what he said about, yeah, in the case, the complications we have of the puckering, let's say, or showing the threads, is two things that cause that. One of them is like if you place it too superficial, let's say, and you know, the picture would be as it shows, so it would be our fault, or like, you know, whoever's doing the procedure. But the second thing is because the period of the time of the aftercare, which it comes with it for 2 weeks, that is a very important, crucial point too, because we need to give time to the collagens to build up around this to become all strong and fixed. Sometimes people go and they don't follow the aftercare, and they start going, start eating steak right after doing the mid-phase lift, for example, or they start going jogging or running or do intense exercises and everything. That would cause problem, and it kind of helps, especially for the people with lack of collagens. It causes a little bit of a migrations too, because we need time for the barbs to fix itself with the help of the collagen that's going to be built up during that time. So these two reasons are the one that could cause the complications, and as I said, we could easily fix them too, most of the time just by waiting.
Good. So the other one is again superficial thread tip. So this happens when you don't basically follow the 2 centimeters, which is the green zone between the tip of the thread and the entry point. So if you don't have that considered, then the tip of the thread might look very superficial, and you have 2 options. You can again remove the thread, or you can create like an X supporting. So if there is a tip of the thread here, then you can create like 2 other thread here. You can insert 2 other thread here to hold it, or you can remove it. And anyway, by just waiting, it will be dissolved by itself. So thank you for your attendance here in this webinar. Right now, we are ready to answer any question that you might have, or any of you guys, if you have an experience with our thread that you want to talk about it, please let us know, and then we're gonna listen to you.
Yeah, so and I think we already answered this question. Can we show? They're asking if we could do cat. Are you asking for the eyebrows and then specific indication? Because this webinar is mostly explaining about the resurfacing and how what's the principle of the threads and how we use them, different kind of patterns and stuff and combinations. But if you want specific and particular indications, you could always set up a time with us, and we'll be happy to go over the indications together through the Zoom call one-on-one, and be able to answer all your questions. And that's not a problem. Just contact us, and we go through it together. So we kind of help you out to do the procedures if you already have a thread, to show you the mapping, the techniques, the steps you need to take, each individual things. Also, we have a lot of different options of the trainings and packages that you could always ask. We'll be happy to even spend time with you. We have different options that we come and we spend 5 hours with you, one of us, and we go over as many patients as we can during that time, and we make sure to train everyone, all the people who are qualified for these procedures, of basically covering all the mappings. And also we have advanced training too for the body, for the butt lift, for the 15-centimeter butt, basically for the boobs, for underarms, inner thighs, and everything else. Just a little bit more advanced, but we could always set that up too and create some kind of Zoom training or in person in the office training.
Yeah, regarding the this question about the resources during the training, you will get the basically studies we have. We will get the PowerPoint and the presentation that is related to that training, and also the videos which are specifically designed for each indication. Yeah, these are basically what you get.
And also to answer, someone, I think Aldin already asked for us too, because he had a case and says somebody actually had the stake and had that problem, and it smoothed up itself after waiting. Thanks for supporting. And also the other question is, should the patient see the instant results, or can it take a few weeks? Again, as I explained, to the whole process of the threads, we know we're placing it in there. We're doing a bit of a very natural, instant results. So that's why we saw that reactions with the pictures. They get very happy and they see some results, but I always tell them that the actual results comes in like a month and a half to 2 months. So even if they don't get like a very extreme results, always just tell them how it works, how long it takes, and what they're expecting. And then they have so many cases that they contacted us even. They're like, oh, we haven't seen much results. And we have the picture of the first day, and then we have the picture of them that day, and we put them together, send it back to them, and they see the differences. It's just the fact is very organic look and natural. It goes day by day, so they don't see like a sudden extreme things like you're doing a facelift, Yeah. And I'm just going to add this last thing, because I think it's a lot of people sometimes they ask like, what's the difference? Why do I have to do this instead of doing facelift? So my answer to them is this: when you do the facelift, yes, you start pulling the skin, you cut the excessive ones, and you tie them back, and you make it very stretch, sometimes a little fake and extreme of a facelift, and makes you look very young and everything, and that's great. But what you have to realize is that as he's aging, or whoever is aging with that procedures, under the skin, nothing's growing, nothing's happening. So under the skin is getting older and older with more lack of collagens, but then the surface, it looks very good. But when you use threads, you gradually build up a lot of collagens, and you get basically the surface is getting better because we're doing a very natural lift and it's not extreme. But at the same time, after 2 years, let's say, when they start aging, their aging is much slower than someone who's done the facelift, because they have so much collagen, they have to start losing it slowly. So I think this is a very comparison that a lot of people ask, why should I do this instead of that? Because we're working on both superficially for the look, and also we do something for the skin and the tissues.
Plus, they are able to go for plastic surgery after thread, like 5 years after thread, 3 years after thread. There is no problem. One more question they asked about training. We go over face, body, breast, everything that they want. It depends on, we have more than, let's say, 30 different indications for HDPDO thread. So in one training, we cover as much as we can. And basically, we have like the selection of more common and general indication that we usually go over that for the first training. And training is something that never stops. And in MedResult, we try not to charge you for training or not to charge that much for training, because we believe training is something that is on our shoulder to provide. And when you buy your basically kits, the training comes with that. For pregnancy, it is contraindication and it is not contraindication. It means that if a pregnant woman cut her hand and then you have to stitch it, so you use PDO to stitch. But because you don't want to cause or you don't want to have any kind of possible problem in the future, which is not necessary, so we don't touch a pregnant woman for beauty indications or for rejuvenation. She needs to wait after that.
I just want to add one more thing. It was a question about, which I'm going to share with everyone. So, is there a degree of laxity so bad that the PDO could not be indicated? Yes, but we have the products that we actually have, we're offering, and most of the doctors who are working with us, they usually have both products that we're offering. These two, like they have HDPDO threads, and also they have the Plexo device that we have. It's a pure plasma that we're using. It's a very high technology, again, Italian device that we've been using. And they always have both, because with these two, they could cover everything. And in this case, for example, we have cases with just as an example, we could do a lot of things with the platysma bands on the neck. We could take care of a neck with threads, and it's a great option. But there are certain cases such as what we call a turkey neck, if you guys know, and it's so extreme that yes, you could fix it with threads, but you have to do so many threads that it's just almost not worth it. And I think you've seen some pictures, actually, like scary pictures on Instagram, which we're against those. So they'd use like, I don't know, 100 threads on the skin. I think these are like Korean brands or whatever. But in those cases, yes, then they go to the options of the plasma, pure plasma, and then they could get rid of the excessive skin in like 1 or 2 session max, like a much easier way with the quickest results. So for us, results matters, obviously, and we wanted to get the best results, and as you always say, like in a minimum of the time, a minimum of a downtime, and the most comfortable way for the patients. And that's why we always offer these two products, that it's best combination to have, and there will be nothing out there for you that you could not fix with either threads or Plexer, because threads, you could basically put them on 99% of your body, anywhere, any indication it comes up. Except the male genital, obviously, and also the orbit. But at the same time, even for the under eyes that we don't do threads, these are the areas that we don't use threads. For under the eyes, for the blepharoplasty, for the wrinkles, that is very extreme. You would need so many threads. Then they keep using our other device, which is products, which is Plexer. And if you guys need questions or have questions about that, I have beautiful videos and pictures of them, and you could see how they work.
Dr. Lopez shared a good experience about her patient that came back after 1 year to repeat the HDPDO because they were very happy with the result. And she said that I was impressed from the before and after of 1 year. So the reason why you have this impressive result is we are using HDPDO. The HD factor of the PDO makes it basically more durable, and it stays in the body even about like 8 to 12 months. So it means that when the thread stays in the body, it means that the rejuvenation and collagen production of the result of the basically procedure is continuing even after 1 year. So if you take pictures like every month after HDPDO technique, you see improvement even after a year. And that's why they come back, and I'm very happy that you had this result, and I really appreciate it. So one more thing I wanted to tell you. So there is one point about who is not a good candidate for the PDO technique. Basically, to PDO is based on two factors. One is creating a mesh, and the other one is hooking and attaching to the skin to lift the skin. So if your purpose of treatment is to hook and attach to the skin to lift this, then you need to have enough collagen. If the skin, it means that if the skin is too loose, and if somebody has really destroyed an atrophic dermis or subdermis, and it's too loose, then they're not a good candidate for threading. You need to have enough tissue and kind of good tissue to be basically attached to the barbs. And the solution for this kind of people is you can basically implant some smooth thread first in the dermis or subdermis and wait for 2-3 months. These the presence of smooth thread in that area will basically activate and generate collagen and enough tissue. Then after 3 months, after 6 months, you are able to lift that tissue as well.
I am actually, sorry, wait, can I say something? I just wanted to, because people are asking me if they could put a one-on-one Zoom call for consulting and for even refreshing. For the people who are using our threads already, they could always set up a time, and I'll be happy to go over and review with them just to refresh their, the memories with the techniques and everything, and also for the consulting, more details. If they want to know more about our techniques, feel free to book, and I'm going to just set up the, put my email address down here and our phone numbers and the contacts. You can always contact us, and then we'll set up a time for you, and I'll be happy to answer all your questions.
Yeah, also for the last week of the year, we have very specific offers and promotions, so you can talk to Murray about them and get that offer. It also helps. So if there is no more question, we let you guys go and enjoy rest of your weekend and spend time with your family, which I believe is the best thing to do in the whole universe. Okay, guys, thank you so much. Thank you, everybody, for joining us. We see you next year.
Hopefully.
Yeah, okay. See you 2021. Stay safe.
Take care, guys.
Bye-bye.
Have a good one.